The fluorescent lights in the hallway always buzzed before midnight. Kate Brennan counted the flickers without meaning to. 2-3 pause. The bulbs hummed overhead, throwing flat white across the scuffed linoleum of Lonier VA Medical Center. Her right leg dragged a fraction behind the left, the familiar pull in her hips sinking with the sound. 1 step, 2-3, clipboard against her chest, ID badge tapping the plastic with each uneven stride. 18 steps from the locker room to the nurse's station. She had checked once out of boredom during her first month back. Now she knew it the way other people knew passwords. If she hit the station in 17 or 19, it meant something in the universe had shifted when she was not looking. Tonight she landed on 18. Nurses leaned over computers, the air thick with the smell of burnt coffee and antiseptic. Somewhere down the hall, television in a waiting room muttered a late-night sitcom to no one in particular. The sound of canned laughter felt wrong in a place where people came to remember wars that never made them laugh. Brennan, the voice floated over the soft chorus of beeping monitors. She did not have to look to know who it was. Dr. Marcus Webb stood at the counter, sleeves rolled, stethoscope looped carefully around his neck, like it had been staged for a photo shoot. Early 30s, sharp jaw, sharper mouth. He did not look tired enough to be 3 years into a residency. That annoyed her more than it should have. "Chart for bed 7, he said, holding up a folder between 2 fingers. "You missed a signature." She stopped beside him, her right leg locked for a half second before catching up. The old shrapnel deep in the muscle tissue making its presence known. It always did around midnight, some kind of biological clock that reminded her of things she tried to forget. "I was busy stopping bed 12 from aspirating," Kate said. "Priorities." He gave her a brief, polished smile, the kind that never touched his eyes. "Paperwork is a priority too, especially when some of us need everything to look perfect." The implication hung there. Nurses like you, nurses with a limp, nurses whose files probably had more red ink than black, nurses who had been somewhere else for this hallway doing things that did not translate well to civilian competency reviews. Kate took the folder, scanned the order, signed where he had circled in his precise handwriting. "All done, doctor." She handed it back. "Anything else you need from me tonight?" "Alphabetizing your pens, color-coding your ego." A snort came from the other side of the station. One of the older nurses covered it with a cough. Webb's smile thinned. "I just prefer the more mobile staff on trauma cases. Less liability if someone has to actually run." Kate slid the chart back to him. Her hand did not shake, but she had to concentrate on that, on keeping everything steady, on not letting 3 years of this kind of comment pile up into something she would regret saying out loud. "I can run," she said quietly. "I just do it with a soundtrack." "That clack your cane makes on the floor?" he asked lightly. She did not carry a cane, had not for 2 years. The physical therapist had cleared her. The limp remained, but the assistive device was gone. Webb knew that, everyone knew that, but the comment landed anyway the way it was designed to. "This one doesn't clack," Kate said, keeping her voice level. "Budget cuts." Webb opened his mouth, but another voice cut in. "Dr. Webb, unless you have discovered a way to sign your own nursing forms, I suggest you let Brennan work." Dr. Rachel Stone did not raise her voice often. She did not need to. Words from the ER chief traveled differently. People heard them with their spines. She approached the station with a tablet tucked under one arm, dark hair twisted into a knot at the back of her head. The fine lines at the corners of her eyes deepened when she looked at Kate. Just for a moment they softened. "Vitals on the overnight admits," Stone asked. "All stable," Kate said. 14's still a little tacky, but within range. I set a reminder to recheck in 30. "Good." Stone flickered her gaze to Webb. "You don't need to ride her, Marcus. She knows her job." Webb shrugged, palms open in mock surrender. "Just doing mine, Dr. Stone." He walked away, shoes whispering over the floor. Kate watched him go, then looked back at Stone. "You know he's not wrong," Kate said quietly, "about the running." Stone tilted her head. The tablet in her hands reflected the overhead lights, casting a faint glow across her face. "Did you fall behind anyone tonight?" "No." "Did a patient suffer because you didn't move fast enough?" "No." "Then we're done with that conversation." Stone tapped the edge of the tablet against the counter. A small sound, but it had finality. "Go check on bed 9. The new guy keeps hitting his call light because he likes the sound." Kate nodded and pushed off the counter. 1 step, 2-3. The rhythm was back. The cane was a ghost limb she did not carry but felt anyway. Every comment from Webb or the others added weight to something that was not there. A phantom burden. At bed 9, a young man in a faded Marine Corps shirt grinned sheepishly as she adjusted his blanket and turned off the call button he had mashed 3 times in 5 minutes. He reminded her of other young faces under other harsh lights, but she pushed that away. This was San Antonio, not Nuristan Valley. This was a hospital, not a forward operating base. The distinction mattered even when it did not feel like it did. By the time she finished rounds and returned to the nurse's station, the clock on the wall read 11:47. The night had settled into that strange hospital quiet, all low voices and distant alarms. The kind of quiet that felt like holding your breath underwater. You knew you would have to surface eventually, but for now there was just the muffled pressure of waiting. The fluorescent lights flickered. The world did not blink out, but for a heartbeat, the hallway dimmed. Kate looked up automatically. The bulb nearest the staff restroom buzzed, stuttered back to full brightness, then steadied. "You reported that one yet?" the charge nurse asked. "Twice," Kate said. "Maintenance loves to pretend it's a feature. Think it's haunted." "It's a VA hospital," Kate said. "If anywhere is haunted, it's here." A low chuckle threaded through the station. Someone poured another pot of coffee. The smell was bitter and comforting at once. Kate checked her watch. 13 minutes until midnight. Her right hip had started its slow ache. Saw the metal pins inside reacting to the change in barometric pressure the way they always did. Weather was coming, rain probably. Her body had become a forecast system she could not turn off. She shifted her weight, rolled her shoulder, told herself she might sit down for a second. She did not sit down. Instead, she picked up the chart for bed 14, pretending she cared about Webb's clean signatures, pretending the stack of papers in her hands was the most important thing happening in the building. The routine was armor. It kept her hands busy. It kept her mind from wandering back to places that did not have fluorescent lights or coffee machines or call buttons that young Marines press for company. She walked toward the room. 18 steps, then 2 more, then a left at the crash cart. The air seemed thicker now, the quiet with an edge. She reached the doorway and paused. Bed 14 slept, chest rising and falling in a slow hypnotic rhythm. The monitor traced a green pattern across the small screen. Everything was ordinary. Kate exhaled a breath she had not known she was holding. She closed the chart, turned back toward the nurse's station. She made it 10 steps before the overhead speaker crackled. "Attention all air staff." A voice, tight and clear. "We have a mass casualty incident incoming from Red River Naval Station. Repeat, mass casualty from Red River Naval Station. Multiple criticals. ETA 15 minutes. All trauma bays to be prepped. All available personnel report to the emergency department now." The words hit harder than any alarm. The nurse's station exploded into motion. Chairs scraped, phones rang, cupboards banged open. Kate stopped in the hallway, her fingers curled tighter around the chart handle. For a fraction of a second, she heard nothing but the distant chop of rotor blades in her memory. Hot air, sand, shouting in another language, the smell of burned metal. She blinked. The sound snapped back to the muted chaos of the hospital. 18 steps, she thought. She turned toward the trauma bays and started walking. Not counting this time, just moving. Because when the call came, you did not think. You did not hesitate. You moved. By the time Kate reached the trauma bays, the ER had shed its late-night drowsiness like a snake shedding skin. Curtains that had been half drawn were tied back. Carts rolled into place. Someone killed the waiting room television, and the canned laughter cut off mid-joke. The building shifted into a different kind of breath. Faster, sharper, ready. "Brennan with me." Dr. Rachel Stone stood at the center of it, the eye of a storm that had not landed yet. She held a clipboard not because she needed it, but because it gave other people something to look at besides her face. A face that had seen this before, multiple times, in places where the word casualty meant something different than it did in textbooks. Kate moved to her side. Her right leg protested at the sudden burst of speed, a hot line from hip to knee. But she ignored it the way she ignored most things that did not immediately threaten patient outcomes. "Report," Stone said. "All current patients stable," Kate answered. "Telemetry is ready to take overflow. Imaging is on standby. We cleared bays 1 through 4. "Good." Stone raised her voice slightly, not a shout, just projection, the kind that cut through noise without adding to it. "Listen up. This is a training incident gone wrong at Red River Naval Station. That means mostly young, mostly fit, and a lot of blunt trauma. We won't know full count until they're through our doors, so assume there are more behind the first wave. Residents and nurses clustered near the central island, faces pale in the harsh light. Some of them nodded, some of them stared at the floor. The ones who stared at the floor were the ones Kate watched. Those were the ones who would freeze when it mattered. Stone pointed, quick and precise. Dr. Webb, you have Bay 1, Dr. Harris Bay 2. I want Brennan on Bay 3 as primary nurse. Webb had just opened his mouth to speak. He pressed his lips together instead. For a heartbeat, his gaze flicked to Kate's empty hand, then lower, to the leg that did not quite match the other. The calculation happened behind his eyes. Fast math about liability and competence, and whether this was the hill he wanted to die on in front of the chief. Yes, ma'am, he said. The words were correct. The tone was not. Kate pretended not to notice. She had practice at that, too. They broke formation. Nurses sprinted for supply rooms, pulling extra IV lines, respiratory kits, warm blankets. The smell of alcohol wipes and plastic grew thicker. Somewhere in the distance, the first faint wail of an ambulance siren rolled nearer. Then another, then two more, weaving together into one long sound that made Kate's jaw tighten. She stepped into Bay 3. The room looked smaller when it was empty. Monitor screen dark, trauma tray still covered. She flicked on the overhead light, its cool glare washing the bed in white. She moved without thinking, hands following a pattern they had learned in tents, in field hospitals, on dirt floors under tarps. Oxygen mask, airway kit, chest tube tray, blood tubing, suction. She checked each item like she was touching points on a map, verifying coordinates, making sure the ground was solid before the weight hit. Her hip twinged when she leaned for the lower shelf. She exhaled through her nose, steady and slow. The ache was not new. It was just louder tonight. Pain had a way of announcing itself when adrenaline started to flow, like it wanted to remind you that you were still flesh, still breakable. Brennan, Stone had returned to the doorway. Her eyes swept the bay, took in the arrangement in one glance. 30 years of emergency medicine compressed into a single moment of assessment. That'll do, Stone said quietly. You good? Yes, ma'am. Stone watched her a second longer, as if weighing how much of that was true. Then she nodded and moved on. The sirens grew louder. The sound pressed against the walls. Overhead, the fluorescent lights hummed. One of them flickered twice, then held. Kate went to the sink, scrubbed in, dried her hands. She flexed her fingers, feeling the familiar crack in the skin beside her thumb where sanitizer lived. A paramedic once told her you could tell how hard a hospital worked by the hands of the nurses. Hers looked like they belonged to a much older woman, cracked, scarred, competent, incoming. The automatic doors to the ambulance bay slid open. Cold air pushed in, tinged with diesel and the faint metallic scent that always rode under serious blood loss. Voices layered over one another, paramedics calling out vitals, numbers, mechanism of injury. Bay 1 male 20s fall from height altered mental status. Bay 2 female chest impact hypotensive. Bay 3 female early 20s blast pattern multiple shrapnel wounds. Kate stepped forward as the gurney for Bay 3 swung into place. The wheels rattled over the threshold. The young woman on the stretcher wore fatigue pants and a dark training shirt sliced open down the middle. Her skin had that washed-out gray cast that never meant anything good. Name, Kate asked, moving to the head of the bed as they transferred the patient. Petty Officer Rowan, the paramedic said, breathless, running on fumes and adrenaline. Explosion during breaching drill. We think she caught the blast edge when a door charge misfired. Pressure's been dropping en route. Last BP 80/40. Pupils reactive. GCS 12. Blood oozed from small cuts scattered across Rowan's left side, peppered like someone had thrown gravel at her. Bruising spread purple and ugly along her ribs. An oxygen mask fogged with each shallow breath. 2 large-bore IVs, Kate said. Not a question, a statement. One in the field right AC. Couldn't get a second. I'll fix that, Kate said. Did anyone listen to her chest? Equal breath sounds at first, the paramedic said. But then she started working harder. Kate touched Rowan's sternum gently, feeling the rise and fall. Too fast, too shallow. Her eyes flicked to the monitor as it came to life. The green line jittering across, heart rate 130, oxygen saturation sliding down from 90 to 88, 86. Webb pushed into the bay, snapping on gloves. He glanced at the monitor, then at the wounds, then at the paramedic. Get a chest x-ray, he said, and type in cross 4 units. Kate's voice came out before she thought about it. Steady, certain. The voice she had used in other places when time compressed and decisions had to be made in seconds, not minutes. She doesn't have time for imaging. Webb looked at her as if he had forgotten she was there. What? Her trachea is deviated, Kate said. Look at her neck. He hesitated, then leaned closer. The notch at the base of Rowan's throat sat a fraction to the right. The veins along the side of her neck stood out, swollen and tense. On the left, the chest rise was barely there compared to the right. We need to wait for the X-ray, Webb said. His voice was flatter now, but she saw the uncertainty flicker under it. The split second where training met reality and found a gap. We don't do blind procedures when we can avoid them. She'll be in arrest by the time the film loads, Kate said. This is tension pneumothorax. Breath sounds diminished on the left hypotension distended neck veins. You have textbook in front of you. That's enough, Webb snapped. Someone get radiology on the phone. Rowan gasped, a wet rattling sound. Her oxygen saturation dropped another 2 points. Kate felt the old training settle over her shoulders like a weighted vest. It narrowed the world to a set of steps. Identify, prepare, act. She had done this before. Not here, not in a bay with clean walls and working lights. But the mechanics were the same. Tension pneumo did not care if you were in a field hospital or a level 1 trauma center. It killed the same way. Dr. Stone approved combat protocols when indicated, Kate said quietly. I'm indicating. She moved to the supply cart before Webb could answer. Her hand closed around a 14-gauge needle catheter. She did not raise her voice when she spoke, but she did not leave room for argument either. High-flow oxygen, she said to the respiratory therapist at the foot of the bed. Prepare for possible chest tube, starting needle decompression. Webb stepped in front of the tray, blocking her. You don't get to make that call, Brennan. Then make it, she said, but do it fast. For a moment, his jaw worked. No sound attached to it. The monitor alarm chimed a higher note. Rowan's lips took on a bluish tint beneath the clear mask. Move, Kate said. The word came out low and even. Not a plea, not anger, just direction. The kind of tone that did not ask permission because asking took time and time was something this patient did not have. Webb shifted aside. Kate swabbed the skin at the second intercostal space, mid-clavicular line, counting ribs with her fingertips. The familiarity of the motion steadied her. This she knew. This she had done. Needle between fingers, angle just above the rib to avoid the nerve bundle, push until the resistance gave way. She slid the catheter in. For an instant, there was nothing. Then a hiss. Trapped air rushed out, hot against the back of her hand. Rowan drew a deeper breath. The first real one since she had arrived. The oxygen saturation climbed. 86, 88, 90. The line of Webb's shoulders loosened a fraction. He watched her. Something new in his expression that was not quite resentment and not yet respect. Somewhere in between. A recalibration happening in real time. Get surgery on standby, he said, recovering his voice, finding the script again. She'll still need a chest tube and likely exploration. Already paged, Kate answered. They worked in concert for a few minutes. Long enough to stabilize Rowan with fluids and pain medication. Long enough to tape down the catheter so it would not dislodge on the way upstairs. When the surgical team arrived with their rolling tower of instruments, Kate rattled off a concise report. Her phrases clipped, efficient, the language of handoff that left no room for misunderstanding. The surgeons nodded and wheeled the bed away. The bay fell empty when they left. The smell of blood and antiseptic lingered, along with the echo of the monitor alarms. In the doorway, Stone appeared again. Her gaze swept the cleared space, then landed on Kate. I heard you picked up a needle, Stone said. Kate peeled off her gloves, dropped them into the biohazard bin. Yes, ma'am. Good call. Stone turned to go, then paused. Where did you learn to do that so fast without imaging? Kate dried her hands on a towel. The automatic answer sat on her tongue. YouTube, field manual, simulation training. She bit it back. Stone's eyes on her face made the joke feel smaller than usual. Old job, Kate said instead. Stone's mouth tightened, not in disapproval, more like recognition. She gave a short nod and moved on to the next bay. The sirens had not stopped. More gurneys rolled in and out, some heading straight to surgery, some to CT, some to the beds of the ward upstairs. For the next 20 minutes, time blurred into a string of vital signs. Bandages, shouted lab values. Kate barely felt her hip anymore. The ache was there, but it rode under the adrenaline. a dull background hum she could ignore when there was work to do. She was adjusting an IV pump in Bay 3 when another set of doors swung open. Commander mid-30s, multiple shrapnel, possible internal bleeding, a paramedic's voice called out, strained but controlled. Stabilized in field, but he started dropping pressure 10 minutes out. History of prior combat injuries. They steered the gurney toward Bay 4. Kate glimpsed a torn navy blouse, streaked with dirt and blood. The glint of a trident insignia on the ruined fabric. Her stomach tightened. She told herself it was just the pattern. Naval station, special operations units trained nearby. Seeing a SEAL insignia here did not mean anything. She turned back to her chart, pen scratching across the paper, handwriting neat from years of practice. The sound of wheels approached again. Voices overlapped. Someone diverted the commander to Bay 2 instead. There was a shuffle, some quick reassigning of rooms, the usual chaos of a surge. "Brennan," a nurse called, "can you help with the airway in Bay 2? "On it," Kate said. She left the chart on the counter and grabbed a fresh pair of gloves. Her hip protested when she pivoted. A quick stab of pain. She ignored it and pushed through the curtain into Bay 2. The man on the bed was pale under the overhead light. His hair plastered to his forehead with sweat and dust. Dried blood crusted along his jaw, trailing into the collar of his torn blouse. The SEAL trident caught the light. He looked older than the last time she had seen him. Harder somehow. But the line of his mouth, the cut of his cheekbones, the scar that ran from his left eyebrow to his temple. Unmistakable. For a second, Kate could not move. The rotor sound in her ears was so loud she almost missed the monitor beep. Noise fell away. All that filled her vision was the face of the man whose weight she had carried across rock and dust and broken ground. His eyelids fluttered. He forced them open, as if the act cost him something. His gaze swept the room, unfocused at first, then sharper as it landed on her one. Recognition flared. "Nightingale," he breathed. Kate's hand tightened around the bed rail. For a heartbeat, Kate thought her knees might give. The word hung in the air, small and quiet, but it cut through the noise in the bay like a blade through silk. Nightingale. No one in this building had ever called her that. Not out loud. "Brennan Airway," someone reminded her. The sound snapped her back. She forced her fingers to unclench from the bed rail and moved to the head of the bed. The respiratory therapist slid over to make room. The intubation tray waited, already opened, instruments gleaming under the harsh light. "I'm fine," the man on the bed said. His voice was rough and thin, but the cadence was the same voice that had yelled over gunfire, that had cursed at her while she dragged him over rocks. "I'm fine." "You're not fine," Kate said. The words came out automatic, professional, a shield she could hide behind. "You're in an ER with half your blood on your shirt." A corner of his mouth twitched. It might have been a smile if there had been less pain behind it. "You hear that?" one of the residents said from the side of the bed. "Alert and oriented ×3. "Commander Hawthorne," the paramedic corrected, adjusting the bag valve mask. "Pressure 85/50. He's compensating, but we don't know for how long." "Commander," the rank snapped into place with the name. Lucas Hawthorne. Of all the people who could have come through those doors tonight, it had to be him. "Let's get the rest of his gear off," Webb said, stepping into the circle. He had finished with Bay 1 and moved to where the action was. "I need a full assessment." They cut away the remaining fabric. Dress shirt ragged and burned at the edges. A dark spreading stain over the left lower quadrant, more along the thigh. Beneath the cloth, his skin told a map of other stories. Older scars, some white and flat, some ropey and pink. Shrapnel tattoos. "How many lives you got, Commander?" one of the nurses muttered. "Enough," Lucas said. His gaze never left Kate. Webb noticed the focus finally. He glanced between them, frowning. "You two know each other." Kate felt every eye tilt in her direction. The air in the bay seemed to change temperature. "No," she said. "We don't." Lucas gave a short huff of breath that might have been a laugh if it had not ended with a wince. "Oh, I know her," he said, "whether she likes it or not." His hand shifted at his side, the IV line tugging. Kate reached automatically to adjust it, more to give her hands something to do than because it needed fixing. "We can talk about that later," she said. "Right now, we need to get your pressure up." "Later isn't guaranteed," Lucas said. His eyes flicked to the nurses, the residents craning their necks just outside the curtain. "Better to use the time." Commander Webb cut in, irritation creeping into his tone. "You're actively bleeding. You can reminisce with the staff after surgery." Lucas ignored him. His gaze stayed locked on Kate as if the rest of the room were just noise. White noise, background static. Her name is Kate Brennan, he said, voice gaining strength with each word. Nightingale to my men. The nickname stuck after what she did. The word slid into the space like a stone dropped into still water. A ripple moved through the small crowd gathered at the edges of the bay. Commander Webb started again, irritation solidifying into something sharper. Lucas shook his head, then regretted it, eyes closing briefly. When he opened them, they were clear. Afghanistan, Nuristan Valley. 3 years ago this month. Our convoy got sent into a valley that should have been clear. Kate could feel the pull of the memory, dust in her teeth, heat crawling under body armor, the sudden crack of the first round. She swallowed, tasting the ghost of burned powder. Sir, you should focus on breathing, she said. I remember breathing just fine, Lucas said. What I remember is bleeding. He shifted his hand. It landed on top of hers where it rested near the edge of the gurney. His grip was surprisingly strong for someone who had lost as much blood as he had. I took a piece of metal to the femoral artery, he went on. Dropped me in the first 30 seconds. I figured that was it. Then someone hit the dirt beside me and cursed me out for being too heavy. The nurses nearest the foot of the bed exchanged a glance. Even Webb's expression changed, curiosity pushing through his impatience. She climbed under fire, Lucas said, used her body as a shield, jammed her hand into my thigh and held on like she was trying to rip the artery out instead of keep it in. His fingers tightened on hers. Kate knew he was trying to ground himself as much as emphasize his words. She dragged me 7 kilometers across that valley, he said, with shrapnel in her own leg, with rounds hitting the ground close enough to kick sand into her face. She refused to load onto the bird until every other wounded man was on board. He took a breath. It shuddered a little, but it was steady. You want to talk about mobility, he said, eyes cutting briefly to Webb. That's mobility. A low murmur rolled through the room. Someone shifted, bumping into a tray. The clink of metal brought Kate back. Commander, Webb said, this time with forced calm. If you rupture something in here trying to make a point, I'm going to be very annoyed. Check his abdomen, Kate said, pulling her hand free gently. Left lower quadrant, it's rigid. Webb moved, stethoscope already in his ears. He palpated the area Kate mentioned. Lucas sucked in a sharp breath, teeth gritted. Guarding, Webb said. Possible internal bleed. Get ultrasound in here now. Nurses launched into motion. One of them still looked back at Lucas and Kate as she moved, eyes wide. At the edge of the bay, the curtain rustled. Dr. Stone stepped in, drawn by the shift in noise, the change in energy. Status, she asked. Commander Lucas Hawthorne, Webb said briskly. Multiple shrapnel hypotensive, likely abdominal bleed. I'm getting a fast exam and calling surgery. And in the middle of all that, Lucas added, I was just introducing myself to the staff hero. Stone's gaze clicked to Kate. Something flickered there. The ghost of an old question she had never asked, now nudged closer to the surface. Is that so? Stone said. Kate kept her face as still as she could. He's confused. Lucas snorted. I'm not confused. I gave her my blood type while I was half unconscious. You don't forget the person whose hand is inside your leg. One of the younger residents made a choking sound. Half laugh, half horror. Stone's mouth twitched. Colorful commander. True, Lucas said. The ultrasound tech arrived, wheeling the machine into the bay. Gel probe. The soft mechanical whir of the device booting up. Webb focused on the screen, his shoulders tense. Free fluid, he muttered. Positive. We're taking him up. A flurry of orders followed. Or alert. Consent. Blood bank. Stone stepped in closer to Lucas's head as the team prepared to move. You can tell your war stories after the operation, she said. Right now, you need to let us keep you on this side of the dirt. Lucas nodded once, then looked back at Kate. They told me you got a silver star, he said, and a purple heart. Then 6 months later, you vanished from the registry. Kate felt the old familiar pinch in her chest, the neatly typed discharge paperwork, the signatures that had already dried before she even walked into the room. Paperwork error, she said. The system loses people all the time. Not like that, Lucas said. We tried to find you. He spoke louder now, whether by intention or necessity, as the room filled with more bodies. People who had only half heard the earlier part of the story now caught the thread. My men called you a ghost, he said. They said Nightingale saved our asses, then disappeared into the dark. Silence settled, heavy and complete, for a moment. Kate could feel every gaze on her skin. The nurses who had worked beside her for years. The residents who had rolled their eyes at her caution. Webb, who had once suggested she stick to paperwork. Stone, who studied her face with a new clarity. Not accusation, not yet, just recalibration. Is any of that inaccurate? Stone asked quietly. Kate cleared her throat. The words felt stacked inside it. I was a medic, she said, a long time ago. In uniform, Lucas said. With us. October 19th, Nuristan. You carried me while taking fire. You held pressure on my artery for 42 minutes. You went back into the kill zone twice for men you had never met. He did not look away. Neither did anyone else. One of the older nurses, a woman who had been at Lonier since before Kate arrived, let out a low whistle. Hell, she said under her breath. And we've been making her stock the supply room. Webb shifted his weight. His face had gone a shade paler than usual. Whatever comeback he might have had did not show up. Stone inhaled slowly, then nodded once, as if something in her fell into place. We'll table the personnel history conversation, she said. Right now, let's get him upstairs alive. They started moving. The gurney rolled, everyone working around it in practice choreography. Kate stepped back to clear the way, her hip twinging as she shifted her weight. Lucas reached for her wrist as he passed. His fingers brushed her skin, a brief grounding contact. We're not done, he said, voice low enough that only she could hear. You don't get to ghost me twice. Then he was gone, pushed through the doors toward the elevators, surrounded by white coats and blue scrubs. The bay seemed suddenly too bright and too empty. Kate stood for a second, her hands still half raised, feeling the imprint of his grip. Behind her, the curtain rustled. The distant sirens finally quieted. The ER settled into the messy aftermath of the first wave. Near the nurse's station, the security camera above the main doors glowed with a small red light. It panned slowly, the lens catching faces, movement, everything. Just beyond its arc near the glass wall that looked out over the parking lot, a man in a gray suit stood with his hands in his pockets. Not a patient, not staff, no visitor badge on his lapel. He watched the controlled chaos with a calm that did not match the scene. His gaze paused on Kate, held for a moment, then moved on, as if bookmarking a page in a file. The fluorescent lights buzzed overhead. The little red recording light stayed on. Shift change never came quietly in the ER, even on a normal night. Voices rose and fell at the nurse's station. Scrubs brushed past one another. Someone laughed too loudly at a joke that was not funny. The chart racks emptied, filled again. Kate moved through it all with practiced focus. She checked on Petty Officer Rowan upstairs before the surgical team wheeled her away. She helped settle a concussion and observation. She answered 3 separate questions about Commander Hawthorne's condition with the same line. He is in surgery, that is all I know. People accepted it. They had work to do. By the time the last of the mass casualty patients had either gone to the operating room to CT or to the ward, the sharp edge of adrenaline had blunted. Her body felt both heavy and wired. The ache in her hip had become a steady throb that matched the beat in her neck. She did not sit down. At the station, the charge nurse flipped through a stack of forms, then slid 2 toward Kate. Family updates, she said. You have the words that don't sound like a robot. Kate took the papers. You just don't like talking to crying people. That too. She tucked the forms under her arm and made her way toward the small family room off the waiting area. The overhead lights there were dimmer, the chairs softer, the air heavy with the mix of old coffee and too many hours of worry. 2 young sailors in training uniforms sat side by side on a couch, one with his hands locked together so tightly his knuckles were white. A woman in civilian clothes paced along the far wall. The lines around her mouth were deep, the kind that came from a lifetime of bracing. Kate stepped inside and closed the door gently. Petty Officer Rowan is out of the trauma bay, she said. They've taken her to surgery to place a chest tube and evaluated her injuries. She's stable right now. The woman stopped pacing. Her shoulders dropped a fraction. One of the sailors let out a breath like he had been holding it since the ambulance rolled away. Kate answered their questions. The same ones she had heard 100 times. Will she be okay? How long will it take? Can we see her? The words were always a little different. The fear underneath never changed. When she left the room, the main waiting area felt colder. A few televisions had been turned back on. Muted news anchors mouthing stories behind captions. A vending machine hummed in the corner. Near the glass doors, by the planter full of tired-looking greenery, the man in the gray suit stood where she had seen him earlier. Hands in pockets, shoulders relaxed. The kind of posture that said he was comfortable in almost any room. His hair was cut close. Not quite military, not quite not. He did not wear a hospital badge on his belt or his shirt. He watched a young corpsman argue quietly with an older woman about going home to rest. He watched the volunteer at the information desk stack pamphlets into neat rows. Then his gaze shifted and landed on Kate. It held there. She felt it like a weight between her shoulder blades. He stepped away from the planter and into her path. The movement was smooth, not aggressive, just perfectly timed so that she would have had to physically sidestep him to avoid contact. Nurse Brennan, he said. Her name sounded wrong in his mouth, not because he said it incorrectly, but because he said it like he had tested it before and knew how it fit. Badges are over there, she said, nodding toward the information desk. They like people to wear one. He smiled. It was the kind of smile designed to disarm, easy and pleasant. I'm not a patient or a visitor, he said. I'm with the Department of Defense, David Grant. He reached into his jacket and produced a leather wallet. The card inside flashed an eagle, some lines of text, a photo that looked like him under harsher lighting. Kate glanced at it just long enough to count the letters. D-O-D. The rest blurred in her peripheral vision. Not because she could not read it, but because she knew better than to stare at that kind of identification. It invited explanations she did not owe. How can I help you, Mr. Grant? She asked. The way his eyes sharpened at the question told her he had heard the distance in her voice. I had some questions about the intake tonight, he said. Standard follow-up when an incident happens on a joint training site. We like to make sure our people get the best care. Your people already did, Kate said. If you have questions about protocols, talk to Stone. I will, Grant said, but I was hoping to talk to you first. He said it lightly, like a request about coffee flavors. Kate shifted her weight, felt her hip complain. I'm still on shift, she said. This won't take long, he said. We could talk out here if you like, or somewhere quieter. Something in his tone wrapped around that one word, quieter, and tightened. Kate let herself look at him properly. The suit was expensive without being flashy. The tie a muted blue. His shoes were practical and polished. No scuff marks, no scramble. He looked like someone who rarely ran for anything. His eyes were the only part that did not match the rest. They were not cold, exactly, but there was a flatness to them, a kind of still water where nothing moved unless he wanted it to. She thought of the camera in the corner of the waiting area, its small red light blinking steadily. Staff lounge, she said, 5 minutes. He inclined his head as if she had granted him something more generous. After you. The staff lounge was down the hall, past the lockers and the doors to the supply rooms. It smelled like old microwave dinners and whatever brand of air freshener someone had decided would improve that. When the door closed behind them, the noise of the ER dropped to a muffled hum. Grant took in the room with one sweep. The mismatched chairs, the chipped table, the bulletin board full of flyers, the coffee pot that had seen better years. I'll keep this short, he said. You've had a long night. You saw everything from the waiting room, Kate said. Enough, he said. Your team moved quickly. The young woman you decompressed in Bay 3, for example. Textbook call. He introduced the detail casually, but Kate felt the hairs on her arms lift. That's not public information, she said. Grant smiled again. It did not reach his eyes this time. We monitor radio traffic, and he said, hospital comms dispatch, lots of data points. Part of my job is following those threads. And your job is what exactly, Kate asked. Threat assessment, Grant said, and mitigation when necessary. The word mitigation landed with a soft thud in the middle of the room. He reached into his jacket again. For a second, a muscle in Kate's back tightened, but he only pulled out a slim phone. He swiped once, twice, then turned the screen toward her. A photo filled it. Maya stood at the edge of a brick walkway, a coffee cup balanced in one hand, a tote bag slung over her shoulder. The UTSA logo on a banner flapped just behind her. Morning light caught the reddish strands in her hair. She was laughing at something outside the frame, completely unguarded. Kate's throat closed. She likes the coffee stand by the east gate, Grant said. Usually around 9:15. Black 2 sugars. He watched Kate's face, not the photo. We had an agreement, she said, her voice quieter now. Grant nodded. We did. 3 years, Kate said. You told me if I left quietly, if I kept my mouth shut, she would be left alone. And she has been, Grant said. No car accidents, no break-ins, no random acts of violence. She's thriving from what I can see. Good grades. Part-time work in the photo lab. He tucked the phone back into his pocket, the image of Maya folding away with it. I came here tonight to remind you that the agreement is still in place, he said. You could have called, Kate said. Phones can be traced, Grant said. Misunderstood. Used out of context. I prefer face-to-face when the stakes are personal. He wandered a step toward the single narrow window. It showed a slice of parking lot and a street light buzzing with flying insects. I imagine seeing Commander Hawthorne again was something of a shock, he said. Kate kept her hands flat against the back of the chair in front of her. Her fingers had gone numb. You have intel on the patient list too, she asked. You dragged him across a valley while holding his artery closed, Grant said. Of course I have intel on him. Images came in hot and out of order. The weight of his body over her shoulders, the warm spray of his blood through her glove, the sound of rotors louder with every step. He recognized you, Grant went on, in a crowded ER and in front of a lot of witnesses. He was medicated, Kate said, in shock. Maybe, Grant said. Maybe not. He turned back from the window. The flatness in his eyes had sharpened. Here's the concern, he said. You and I both know that what happened in that valley didn't match the official report. You and I both know there were elements in play that should never have been there. That last line brought the crates into focus, stacked under canvas, stenciled in sharp, fresh lettering. Not local script, not local manufacturer, American markings. Kate swallowed, but the dryness in her mouth did not go away. You signed papers, Grant said. You accepted a medical discharge. You allowed your record to be sealed. In exchange, we made sure no one asked you the kind of questions that would make your life very difficult. You made sure no one heard the answers, Kate said. Same thing, Grant said softly. He took a step closer, not close enough to crowd her, but close enough that she could see the faint crease at the corner of his eye when he smiled again. That deal has worked for all of us, he said. You have a quiet job. Your sister walks around with a coffee cup and a student ID instead of a folded flag. We get to continue operating without unnecessary noise. And if I make noise, Kate asked. Grant looked almost regretful. Then I have to reassess, he said. Ask myself whether the original mitigation plan was sufficient. The air in the small room seemed to thicken. The hum of the vending machine just outside the door became louder in her ears. You're here to threaten my sister, Kate said, in a hospital, on a night when half my staff just saved your people. I'm here to remind you what keeps her safe, Grant said. Nothing happens to her as long as you stay who you are now, Nurse Brennan. Competent, quiet, invisible when it matters. He let that hang for a second, then eased back. Not Nightingale, he continued. Not the medic who went back for bodies and asked about the wrong markings on the wrong weapons in the wrong hands. He checked his watch, an almost absent gesture. Commander Hawthorne is a complication, he said. He has a reputation for loyalty, for stubbornness, for not letting things go when they smell wrong. He knows not to talk out of turn, Kate said. Maybe, Grant said again, but he's already connected you to Nuristan in front of your colleagues. He's already said too much in a room with too many ears. He reached for the door handle, then paused with his hand on the metal. I'll be talking to him next, he said, whetting expectations, making sure he understands the cost of curiosity. Something hot moved under the ice in Kate's chest. You leave him out of this, she said. Grant tilted his head. You're in no position to dictate terms. He opened the door a few inches, enough for the hallway light to cut across the lounge floor. You have my word, he said, that as long as you continue to honor our agreement, Maya will finish her degree, get whatever job she wants, marry whoever she chooses, and die at a very old age in a very comfortable bed. He stepped out into the corridor. All you have to do, he said, is nothing. He walked away, his shoes whispering over the floor. Through the narrow gap before the door swung shut, Kate saw him turn in the direction of the elevator bay. His expression already smoothed back into something pleasant. The hallway outside the staff lounge felt too bright when Kate stepped back into it. Voices washed over her again. A tech wheeled a portable monitor past. Somewhere a patient coughed, wet and deep. The smell of disinfectant tried and failed to erase the copper edge of blood that clung to the air after a busy trauma night. Grant was already gone. For a second, she considered walking straight to security, asking for an incident report, something official that would put his visit on record. Then she remembered the ID wallet, the way the receptionist in the lobby had glanced at him and then quickly looked away. There would be a record if he wanted there to be one. Her pager buzzed at her hip. She looked down. Bay 2. She shoved Grant into a mental box and snapped the lid shut. Bay 2 meant a patient, and patients were easier than men in suits with photos of her sister. By the time she reached the curtain, her breathing had evened out. Her hands knew what to do, whether her head was ready or not. Inside, things were less frantic than before. The crash carts had been pushed back against the wall. The floor had been wiped. Commander Lucas Hawthorne was gone. Up the elevator and into the maze of the operating suites. In his place, Dr. Stone and Dr. Webb stood near the empty bed talking in low voices. Webb held a chart but was not looking at it. Stone listened, one hand on her hip, the other loosely holding her tablet. They both looked up when Kate came in. "How did the family updates go?" Stone asked. "Fine," Kate said. "They have something to hold on to, for now." "Good," Stone said. Webb cleared his throat, then looked as if he regretted drawing attention to himself. "So," he said, "the commander. He was serious, right? About the valley, about her." He nodded toward Kate without quite facing her. Kate folded her arms. "You can file a complaint with HR if you think I'm misrepresenting my CV." Webb blinked. "That's not what I said." "You implied it earlier," she said, "about mobility, liability." Color rose in his face. His grip tightened on the chart. "I was talking about safety," he said. "I did not know you were out there playing combat medic." Stone lifted a hand. "Enough. This is not the time." Webb blew out a breath. His gaze slid to Kate again, this time less sharp, more uncertain. "Look," he said, "if he's right and you did what he said you did, then I owe you an apology for some of the things I've assumed." The words came out stiff, like they had caught on his teeth. Kate stared at him, thrown off balance. The ER did not often produce apologies, not the real kind. "You don't owe me anything," she said quietly. "You owe the patients your best work." That's it. He opened his mouth and shut it. The apology hung there anyway, visible in the set of his shoulders. "Commander Hawthorne is in OR 3, Stone said, pulling them back to the present. "He's in good hands. Trauma surgery at this place is excellent when they actually have blood in front of them instead of just boards." She checked her tablet. "Until we get an update, we keep doing our jobs." Webb nodded and left the bay. Stone lingered a moment longer, her gaze flicking over Kate's face. "He called you Nightingale," she said. "It's a call sign," Kate said. "I gathered that," Stone said. "I also gathered that I was right about you not learning field decompressions from YouTube." Kate let out a slow breath. Stone studied her for another long second, then nodded once, like she was filing that answer next to a dozen other small observations. "When you're ready to have a real conversation about that," Stone said, "my office door opens. On purpose." Then she stepped through the curtain and was gone. There was no time to follow up. A monitor alarmed in Bay 5. A confused elderly vet tried to leave against medical advice and had to be coaxed back into his bed. A supply cart tipped, sending gauze and alcohol pads spilling across the floor. The rhythm of the ER pulled Kate back in. Hours folded and unfolded. The digital clock above the station ticked past 3 in the morning. Then 4. No one mentioned Grant. No one knew to. Whatever conversation he had with Lucas in the OR holding area, if it happened, took place out of her sight. She tried not to think about Maya walking across campus with coffee in her hand. Eventually, the surge eased into something like normal. The mass casualty incident became a cluster of notes on a whiteboard, a shift report, a story to be retold at quieter times. Kate was updating a medication list at the nurses' station when the elevators dinged. The doors slid open. A pair of orderlies rolled out an empty bed. Behind them, in a faded hospital gown and a thin blanket, Commander Lucas Hawthorne walked under his own power. His steps were careful, but not as careful as they should have been for a man who had just come out of surgery. His IV pole squeaked with every inch he dragged it. Kate stared. Stone got there first. "You're supposed to be upstairs," she said. "I got bored," Lucas said. His voice was stronger now, tinged with dry humor. "And hungry. They promised me Jell-O and then never delivered." "You're not cleared to be out of bed," Stone said. "Try stopping him," one of the orderlies muttered. Guy woke up, asked where his clothes were, then asked what floor the ER was on. Lucas looked past Stone, his eyes searching the room until they found Kate. "There you are," he said. Kate set down the chart. "You should be lying down." "I will after this," he said. "I'll even eat the Jell-O." Stone exhaled, the sound torn between annoyance and reluctant respect. "You have 5 minutes," she said. "Then you go back to your room. If you drop your pressure in my ER because you're stubborn, I'll personally roll you to ICU." Lucas gave her a small salute with the hand that was not attached to the IV. "Yes, ma'am." Stone stepped aside but did not go far. She leaned against the station watching with interest that she did not bother to hide. Lucas shuffled his way toward Kate. Up close, she could see the strain under the surface of his composure. Lines bracketed his mouth deeper than they had been in the bay. Sweat clung at his hairline. "That's a terrible idea," she said. "Standing or talking to you?" "Both," he asked. "Both," he smiled a little. "Worth it." He stopped close enough that she could see the faint tremble in his hand on the IV pole. "Intel told me something interesting," he said, voice low enough that only she could hear. "You're not in the Army anymore." "Very observant," she said. "We thought you died," he said. The bluntness of it stole her breath more than the content. "After Nuristan," he went on, "after we got back and they pulled us apart for debriefs. 6 months later, your name disappeared from every system I had access to. Nobody would answer questions. Paper trail just stopped. We figured you were dead or locked away somewhere no one was supposed to think about." "So you tried to track me down," she said. "Why?" Lucas's eyes flicked briefly to the left, where the security camera watched. Its small red light glowed steadily. "Because 7 of my men came home who wouldn't have without you," he said. "Because I don't like debts I can't pay. And because something about that valley never sat right." He straightened his shoulders a fraction, winced, and kept going. "This isn't the place," Kate said. Her gaze slid to Stone, who pretended to check her tablet but kept her ears tuned their way. "It's the perfect place," Lucas said quietly. "Too many witnesses." The way he said it made her look at him more closely. His hospital gown hung loose, but the neckline gaped enough that she could see a faint outline of medical tape on his chest, just below his collarbone. Not from the surgery. Newer, cleaner. He followed her gaze, then lifted a hand and peeled the edge of the tape back. Underneath, nested on his skin, a small black device blinked a green light. Her stomach dropped. "You walked into my ER wearing a wire," she said. "Technically, I woke up in your ER already wearing it," he said. "Standard protocol for SEAL officers returning from sensitive deployments. Automatic recording for debrief." She stared at him. "And you didn't mention this earlier because," she started. "Because I didn't know how deep this went," he said. "I just knew that our last mission before I got here was tagged as high risk and high interest. Intel was already listening. When I saw you, it didn't take long to connect the dots." The noise of the ER continued around them. Phones rang. A gurney rattled past. Somewhere a patient complained about the temperature. The green light on the device blinked again, steady and relentless. "Tell me you didn't record him," Kate said. "Who the nice man in the gray suit who told me to stop asking questions about Nuristan, or he might have to inspect my family's brakes?" Lucas said. His tone was light, but there was nothing casual in his eyes. "He came to see you already," said right before surgery, Lucas said. "He has a smooth way of explaining what might happen to people I care about if I keep digging. He likes car metaphors, stairs, random acts of violence." Kate felt cold all over. "And you just stood there and let him threaten you," she said. "I sat, actually," Lucas said. "They had me in a wheelchair." She gave him a look. The humor faded from his face. "I didn't stop him because Intel asked me not to," he said. "They were very clear. They wanted him to talk. They wanted him comfortable. They wanted him to think he was in control." Something in his tone shifted. It was the same voice he used when barking orders in a firefight, tempered now with exhaustion and painkillers. "Where's Intel in all of this?" she asked. "Listening," he said, "on the other end of that signal." Before she could respond, a new sound cut through the ER. It was not an alarm, not exactly, more like an intercom tone followed by a voice that did not belong to any of the hospital staff. "Attention, this is Special Agent Jennifer Blake with the Federal Bureau of Investigation. Staff, please remain at your stations. Patients, please stay in your rooms. We are conducting an active arrest. There is no immediate danger." Heads snapped up. Conversations broke off mid-sentence. The charge nurse froze with a phone halfway to her ear. The automatic doors at the main entrance slid open. A group of men and women in plain clothes and windbreakers walked in with purpose. The yellow letters on their backs unmistakable. FBI. At their head was a woman in a dark blazer, hair pulled back, badge clipped at her belt. Special Agent Jennifer Blake, if Kate had to guess. Beside her, flanked on either side by 2 agents, David Grant walked with his hands slightly raised away from his body. His face was composed, but the color had drained a shade. "Agent Blake," he said, loud enough for those nearest to hear. "You're making a mistake." "That's one opinion," Blake said. Her tone was almost conversational. "David Grant, you are under arrest for violations of federal firearms laws, conspiracy, and making terroristic threats against active duty military personnel, among other things." She recited his rights, clear and calm. One of the agents stepped forward and cuffed his hands behind his back. The metal clicked, sharp and final. The waiting area erupted into whispers. A visitor pulled out a phone. A nurse at the station remembered herself and told them to put it away. Grant's gaze swept the room. For a fraction of a second, it landed on Kate. There was no surprise in it, just calculation, adjusting to new variables. Then he smiled, the same pleasant curve from before, and let the agents lead him toward the exit. The rotor sound in Kate's ears was back, not from helicopters this time, but from the rush of blood in her head. Stone stepped closer to Lucas and Kate. Her eyes were on the agents, but her attention was split. "Anyone want to tell me what's going on in my emergency room?" she asked. Lucas looked at the blinking device on his chest and at Kate. "Short version," he said. The wrong person finally said the wrong thing into the right microphone. Kate did not answer. Her phone vibrated in her pocket, sharp against her thigh. She pulled it out, thumb already swiping to the notification without thinking. A new message waited. Unknown number. She opened it. The photo filled her screen. Maya again, on a different day, stepping out of a campus building, sunlight on her hair, the red dot of a laser sight resting over her heart. The text that came with it was short. "You forgot we're not just one man in a gray suit." Her fingers went numb around the phone. For a moment, Kate thought her vision had blurred. Then she realized it was her hand shaking so badly that the image on the screen wobbled. Maya caught mid-step, one foot off the ground, hair pulled back in a messy knot, a backpack strap cutting across her chest. The red dot sat on her sternum, perfectly centered, small and obscene. "You forgot we're not just one man in a gray suit." The world narrowed to that line. "Brennan?" Stone's voice came from somewhere to her left. The noise of the ER had risen after the FBI walked in. Phones rang again. Someone argued with registration about a copay. A television in the waiting area murmured about a traffic jam on I-10. None of it felt real. "Kate." This time it was Lucas. His tone cut through the cotton in her ears. He had stepped closer without her noticing, the IV pole trailing behind him like a reluctant dog. She realized she was still staring at the phone, her thumb pressed into the glass. She forced herself to breathe, then held the screen out to Lucas. He leaned in, squinting slightly. His jaw tightened. "Who sent that?" he asked. "Unknown number," Kate said. Her mouth was dry. No name, no history, just that. Stone took the phone from Lucas, carefully, as if the picture itself were volatile. "That's your sister," she said. "Yes," Kate said. "That's a laser sight," Stone said. "Yes." Stone's fingers tightened on the phone for a second before she relaxed them. Special Agent Blake had paused near the station to give orders to her team. At Stone's gesture, she broke away and closed the distance quickly, the air around her carrying the sense of someone used to moving into the middle of bad news. "Problem?" Blake asked. "New message," Stone said. She handed over the phone. Blake studied the photo, then the text. Her expression did not change much, but the muscles in her jaw ticked once. "How old is this picture?" she asked. Kate checked the timestamp in the corner. 3 minutes. "She's probably still within a block of that building," Kate said. "Where is that building?" Blake said. "UTSA," Kate said. "Communications Hall, North Side." Blake was already talking into the radio clipped at her shoulder before Kate finished the sentence. "Blake," she said, "I need immediate dispatch to University of Texas at San Antonio Main Campus North Quad. Possible active threat with long gun unknown position. Last known visual of target is a female student, 22, curly hair, brown backpack, moving alone. Get Campus PD on frequency now." Static crackled back, followed by a voice confirming. Another line of chatter overlapped as someone relayed the description. Kate looked at the picture again. 3 minutes. It could have been taken and sent from a window, a rooftop, a parked car. The laser dot could have been resting on her chest for seconds or longer, her stomach twisted. "I need to call her Ooker," Kate said. She pressed Maya's name. The phone rang once, twice, then jumped to voicemail. "Hey, it's Maya. Leave it after the beep or text me." "That's better. I forget to listen to these," the sound of her sister's voice, careless and bright, hit harder than any of Grant's words. Kate hung up without leaving a message. "Try again," Lucas said. She did. This time it went to voicemail without ringing. "Could be bad reception," Stone said. The line did not sound like she believed it entirely. Blake was still talking into the radio. "Units en route," came the reply. "ETA 15. "That's too long, eh?" Kate said. "We're as close as we can get," Blake said. "Campus PD is already moving. They know the buildings. They know the blind spots." "They don't know her routine," Kate said. "I do. She cuts behind the science building to avoid crowds. She hates the main paths. Blake considered that. Call Campus P again, she told the radio. Give them that route. Then she looked back at Kate. You're not going there. That's my sister, Kate said. And this is an active threat we haven't scoped yet, Blake said. I'm not sending an off-duty nurse into a potential shooting scene. I'm not off-duty, Kate said, and I'm not untrained. Lucas shifted his weight, then winced, one hand going briefly to his abdomen. I have a team near there, he said. Navy Intel was already watching the surrounding area for Grant's contacts. We can route them to the campus. He fumbled with the hospital phone at the station. Punching in a number from memory, he turned slightly away, out of habit, even though anyone within 3 feet could hear him. This is Commander Hawthorne, he said when the line picked up. Authentication code Sierra 94 Juliet. I need a protective detail on a civilian target. University of Texas at San Antonio North Quad. Immediately. Target is Maya Brennan, 5'4", brown hair, usually in a bun architecture major, probably carrying a sketch tube. There was a pause, some muffled conversation on the other end, then a response. Copy, Team Hammer is 2 miles out, redirecting. Lucas hung up and leaned his shoulder against the counter, breathing a little harder. You should be in bed, Kate said. So should your sister, Lucas said. Team Hammer will find her. How will we know? Kate asked. Comms go through Intel, Lucas said. They'll feed it back. Blake can patch in through her people. Blake nodded, already on another line, coordinating. Her voice was low, efficient, the kind of tone that calmed the right kind of fear and ignored the wrong kind. For a moment, there was nothing to do but stand and listen to the murmur of radios and the beeps of monitors. Then a different tone came over Blake's radio, sharp and clipped. Unit Hammer to base, a voice said, distorted slightly by encryption. We're on campus, approaching North Quad. No visual on target yet. Keep your channel open, Blake said. Do you have eyes on possible shooter locations? Plenty of high windows, the voice answered. Too many to clear quickly without panicking the whole campus. In the background, Kate could hear faint sounds, doors, echoing footsteps, the murmur of students who did not know they were walking through a grid of gun sites. Keep your distance, Blake said. Don't push at the shooter if you can avoid it. Priority is getting the girl out clean. Copy. 30 seconds stretched thin. Unit Hammer, the voice crackled again. Negative visual. Phone number you gave for the target goes straight to voicemail. Lucas's jaw clenched. Try her again, Kate said. Even though she knew it was pointless, she dialed anyway. Thumb hitting the same smooth patch on the screen. Straight to voicemail. Maya's recorded greeting felt like it belonged to a different world. Static hissed softly from the radio. Unit Hammer report, Blake said. No answer. Team Hammer, this is Blake, she said, voice shifting sharper. Status, silence. Only the background hum of the hospital filled the space. Kate's fingers curled into her palm. Communications glitch, someone offered, from the FBI group. Too quickly. Or, Lucas said, they've been cut off. Stone drew in a breath. It sounded careful. We're not assuming worst case without confirmation, Blake said. Her eyes said she already had. Try backup channel, the agent with the radio said, adjusting a knob, speaking again. No reply. The quiet from the other end said more than any words. Kate felt something inside her tilt. The floor seemed to shift half an inch down. They're going after her, she said, because of Mati. They're going after her because you know enough to hurt them, Blake said. Don't confuse the cause. That's the same thing, Kate said. Her voice came out harsher than she intended. Stone turned toward her fully now, leaving the station behind. You're no good to her if you fall apart, Stone said. She's 40 minutes away. Our protection detail just went dark, Kate said, and someone with a gun and a camera is close enough to put a dot on her chest. Which is why we need to think instead of react, Blake said. We're already moving more units. We'll lock the campus down. Locking the campus down will spook whoever is holding that laser, Kate said. You'll trigger them. Blake did not answer right away. There was no easy argument. Then what's your plan? Blake asked. The question hung there, not rhetorical. Kate glanced at the trauma room doors, at the rows of supply carts, at the fluorescent lights that buzzed overhead. 18 steps to the station. 30 to the ambulance bay. However many miles to the campus. I know that building, she said. I know the old entrances they don't put on the new maps. The service corridors, the basement. Maya studies there all the time. If she's hiding, that's where she'll go. That doesn't mean you walk into it, Blake said. A muscle jumped in Kate's cheek. If it were your sister, she said. Blake's eyes flashed, just once before the professional mask slid back into place. I don't send unarmed civilians into hot zones, Blake said. I can't justify it on paper and I can't live with it in my head. I'm not unarmed, Kate said. I have a trauma kit. That's not what the FBI means by armed, Blake said. Stone exhaled, long and slow. I'm still technically commissioned in the Army Reserve, she said. Kate and Blake both looked at her. I can authorize personnel for emergency response under certain conditions, Stone said. Medical support, not tactical. The letter of the regulation doesn't say they have to stay inside the hospital. You're bending that regulation so far, it's going to snap, Blake said. I'm following it in spirit, Stone said. We have wounded potentially incoming from an off-site incident. I'm sending my best medic. Kate stared at her. You're serious, Kate said. Stone stepped in closer, so that Kate could see the tiny freckle near her left eye she only noticed on long nights. You want to sit here and wait for someone to call you about your sister, Stone said. I can let that happen. Or I can let you walk out of here with a trauma bag and a purpose and a police escort at your back. She moved to the supply closet without waiting for an answer, pulled down a fully stocked field kit and handed it to Kate. The weight settled against her shoulder, familiar and terrifying. Consider yourself temporarily deputized, Stone said. Medically. Blake looked between them, calculating. The fight in her posture eased, not because she liked the idea, but because she saw it was going to happen with or without her blessing. I'll get you a squad car, Blake said after a moment. Lights and sirens. You go nowhere alone. You do nothing without talking to my people on site. You're not law enforcement. You're not to chase anyone with a gun. You are there for your sister and for anyone who ends up bleeding. Understood? Understood, Kate said. Lucas shifted his weight again, setting his jaw. You're not going without me, he said. You can barely stand, Kate said. I can stand enough, he said. I can shoot straight for at least a few minutes. And I owe you and your sister more than a phone call. Stone looked like she wanted to argue. Then she took in the set of his mouth, the determination in his eyes, and swore softly under her breath. Fine, she said. You ride in the back. You don't fall over. You don't rip your stitches. If you go down on my watch because you insist on playing hero, I'll write the saltiest note in your chart any surgeon has ever seen. Lucas smiled, brief and real. Yes, ma'am. 10 minutes later, Stone's sedan was at the curb, with a police cruiser in front and another behind. Red and blue lights painted the hospital facade, throwing shadows that looked too tall on the brick. Kate climbed into the passenger seat, trauma kit at her feet. Lucas slid awkwardly into the back, one hand pressed against his abdomen, the other cradling the IV bag he had refused to disconnect from. As they pulled out, sirens rose, clearing a path through the thinning night traffic. The city blurred past in streaks of sodium orange and neon. Kate stared through the windshield at the dark line of the highway ahead. The rotor sound in her ears was back, but this time it blended with the wail of the sirens, with the hum of the engine, with the pounding of her own heart. She did not count the miles. The highway melted under the wheels in a smear of gray and reflected light. Stone drove like someone who had done convoy duty before, hands at 10 and 2, eyes flicking between mirrors in the road. The police cruiser in front carved a lane, sirens splitting the air. The one behind kept other cars from sliding in too close. Inside the sedan, the noise was softer, but the urgency pressed against the glass. Campus PD has initiated a shelter in place, Blake said over the speaker. Her voice came through the car's hands-free system, tiny but steady. Classrooms are locked, hallways are being cleared, we're narrowing down buildings. Do they know Maya is a specific target? Kate asked. I told them we have a student of interest whose safety is priority, Blake said. I didn't give them details about lasers and hit lists. Panic doesn't help anyone. The thought of Maya in a darkened classroom, listening to a lockdown announcement, with no idea that the voice on the radio was about her, made Kate's chest feel tight. Any sign of Team Hammer? Lucas asked from the back seat. His words were a little slurred around the edges, the effort of staying upright catching up with the anesthesia. Still no comms, Blake said. We have units sweeping their last known route. Nothing yet. Kate stared at the streak of red and blue bouncing off the highway barriers. They were 2 miles out, she said. They should have reached campus by now. Which is why we're assuming worst case, Blake said. I have tactical en route with my team. We're not waiting for all the pieces to line up. Stone took the exit toward the university. The road curved, rising slightly. Ahead, the glow of the campus grew, clusters of lights against the darker sprawl of the city. Street lamps lined the entrance. Banners with the university logo fluttered in the night breeze. The cruiser in front swung into the main drive and rolled to a stop at a checkpoint manned by 2 campus officers. One stepped forward, hand raised, then dropped it when he saw the lights and markings. Stone eased the sedan into a parking lot just off the main road. The cruiser behind them slid into place across 2 lanes, creating a makeshift barrier. When Kate stepped out of the car, the night air hit her in the face, cooler than the hospital, carrying the faint smell of cut grass and exhaust. The sirens cut off, leaving a ringing in her ears. The campus felt wrong in the dark. The buildings were the same as in daytime, brick and glass and steel, but the paths between them were mostly empty. A few clusters of students loitered near the edges, phones in hands, faces lit by screens. Blue emergency call boxes glowed at intervals, tiny islands of light. Blake crossed the lot toward them, phone pressed to her ear. Behind her, 2 more unmarked vehicles pulled in, agents spilling out with radios and vests. "Perimeter is in place around the North Quad," she said, ending her call. "We have plainclothes mixed with campus officers to avoid spooking civilians more than they already are." "Any word on Maya?" Kate asked. "Not yet," Blake said. "We're trying to track her ID card usage, see where she last swiped in." "Communications hall," Kate said. "She had a study group tonight. Architecture kids like the big tables in the basement." Blake frowned. "That building only has 2 floors." Kate shook her head. The trauma kit strap bit into her shoulder as she shifted it. "Old floor plans," she said. "They renovated 10 years ago, turned most of the lowest level into storage. They don't advertise it, but it's still there." "How do you know that?" Stone asked. "Maya sent me pictures," Kate said. "She likes the quiet, says it feels like working in an old subway station. Low ceilings, concrete, bad cell reception." Blake muttered something under her breath that sounded like a word she would not use in front of a camera. "So we have a hidden basement with poor reception that doesn't show on our maps," she said. "Perfect." A campus police lieutenant jogged up, breath clouding in the cooler air. "Agent Blake," he said, "we've locked down communications hall and the adjacent buildings. Students inside were told to stay in place. Most rooms have doors that lock from the inside." "Any sign of our girl?" Blake asked. "Not by name," the lieutenant said. "We don't have biometric gates. We're going door to door to check IDs." "That'll take too long," Kate said. "And if whoever is hunting her hears you knocking, they'll move." "Suggestions," Blake said. Kate looked past them toward the shape of the building in question. The communications hall sat at the edge of the quad, a low, broad structure with long windows along the upper floors and narrow ones near the base. The entrance faced the main path, glass doors framed by stone. "I used to pick her up from that side lot," Kate said, pointing to a smaller road that wrapped around the back. "There's a service entrance near the loading dock, down a flight of stairs. Maintenance uses it. They never lock it on weekdays because people complain about hauling equipment through the front." Stone followed her gaze. "Service entrance means fewer eyes," she said. "Good for getting in, bad for getting trapped." A phone vibrated. Blake checked hers, then exhaled. "Maya's student ID last scanned at communications 15 minutes ago," she said. "Basement level study area. There's no scan for her leaving yet." "Then she's still inside," Kate said. "Or her card is," Lucas said quietly. The thought sat there, heavy. Kate's phone chimed again. Another message. Same unknown number. She clicked it open. "South stairwell, 5 minutes. Come alone unarmed. If we see cops, she dies first." Below the text was another photo. This time Maya sat at a table, head bent over a notebook, fingers smudged with graphite. The camera angle came from above, through a shelf of books. The red dot rested on the side of her neck. Kate's hand tightened around the phone. She forced herself to read the words again, slowly, until they stuck. "We have a location," she said. She showed the message to Blake and Stone. Lucas leaned forward, looking through the open car door. "South stairwell enters the basement near the storage rooms," Kate said. "There's a choke point halfway down. That's where they'll watch." "They're already inside with her," Lucas said. "They took that photo from the stacks." "We can flood the building with tactical from the other side," the campus lieutenant said. "Push them toward the stairs. Cut off escape." "They said if they see cops, they shoot her," Kate said. The lieutenant looked away. His hand flexed near the holster on his belt. Blake stared at the phone, calculating. Then she turned her eyes to Kate. They asked for you, she said. Why, on? Because I'm the one who can hurt them, Kate said. I saw too much in Nuristan. I'm the witness they tried to bury. Maya is leverage. How much do they know about what we just did in the ER, Blake asked. About Grant. They sent that text minutes after he was taken into custody, Lucas said. They were watching him. They probably had eyes on the hospital. They know he's burned. They're moving to secure the asset he was supposed to keep quiet. Blake closed her eyes briefly, then opened them again. Asset, she repeated. Nice to see what side of the ledger they put people on. She handed the phone back to Kate. What are you thinking? Blake asked. Kate stared at the pixelated curve of her sister's neck. The red dot nestled there as if it belonged. I'm thinking they expect me to walk in scared and alone, she said, and that they'll kill her anyway if I don't give them something they want. What's that something? Stone asked. Time, Kate said. They don't just want revenge. They want extraction. They want to get out clean with whatever records, hardware, or contacts they have here. Maya is the guarantee we don't blow the building and sort the pieces later. So you walk into that stairwell, Blake said, and they can play out whatever script they had planned for you 3 years ago. If I give them what they want, I buy you minutes, Kate said. Minutes for your people to find the back entrances, to get eyes on the basement, to figure out how many bodies we're dealing with. If I do nothing, they control the timeline. Blake studied her face. You don't get to trade your life for your sister without my sign-off, Blake said. Watch me, Kate said. The words came out quieter than she expected, but they carried. Stone's jaw tightened. She stepped closer, close enough that Kate could see the faint sheen of sweat at her hairline. If you go in, you go as my medic, Stone said. Not as bait, at least not officially. She turned to Blake. You have people with scopes, Stone said. Put them on the roofs around communications. Use the maps the campus doesn't advertise. There's an old boiler room under there if I remember the service schematics right. You may have more than rifles to worry about. Blake already had her phone out, sending orders. You're both assuming they'll keep their word, Lucas said. No, Kate said. I'm assuming they'll follow their habits. They like control, not chaos. Killing her before they see me would be chaos. Then give them something else to focus on, Lucas said. He pushed off the car seat, straightening slowly. The effort etched lines deeper around his eyes. You're not coming, Kate said. You need someone who can shoot, he said. Someone who knows how these people move. You go in front unarmed, like they asked. I stay in the shadows where they didn't think to look when they sent that text. You barely walked across the parking lot, Kate said. I've had worse days, he said. That's not a point in your favor, Stone said. He met her gaze. With respect, he said, I'm not asking for your permission. I'm asking for your car keys back when we're done. Stone held his eyes for a long moment, then looked at Kate. You trust him? She asked. With my life, Kate said, before she could think of a more cautious answer. Stone blew out a breath. Good enough for tonight. She reached into her pocket and held out her own keys. You're not using a police cruiser, she said. Too visible. You take the service road into my car. Campus PD will open the barrier. Blake snapped her phone shut. Decision settled in her posture. I'll have 2 agents inside on a parallel route, she said. They won't crowd you. Their job is to pick up any pieces you leave. We'll have bomb squad on standby in case Stone is right about that boiler. Kate checked the trauma kit, fingers moving fast. Airway supplies, tourniquets, gauze, IV start kit, sedatives. She felt calmer with the weight of familiar tools in her hands. Her phone vibrated again. Last chance. Alone 5 minutes. She typed with her thumb, each letter deliberate. If she dies, I take everything I know to every camera I can find. You lose the one person who can still keep this contained. She hit send. That's not subtle, Lucas said. They don't deserve subtle, she said. The reply came almost instantly. South stairwell. No cops. We know what you look like now, Nightingale. The name on the screen made her stomach roll. She slid the phone into her pocket and looked at Stone. At Blake, at Lucas. Let's go, she said. Stone squeezed her shoulder once, fingers firm. I'll be on the radio, Stone said. Don't make me drive over there and drag you out. Kate managed a thin smile. Yes, ma'am. She and Lucas climbed back into the sedan. The campus buildings loomed larger now, shapes against the night. Kate gripped the wheel this time. The trauma kit lay on the passenger seat, heavy and ready. The south stairwell of communications hall waited somewhere ahead. a concrete throat leading down into whatever these people had prepared. She eased the car into gear and rolled toward it. The south side of campus felt like the backside of a stage. No banners, no main paths, just a strip of cracked asphalt, a loading dock, and the hulking shape of communications hall rising out of the dark. A single security light over the dock hummed, bathing the concrete in tired yellow. Kate killed the headlights and coasted the last few yards. The car settled into silence with a faint tick of cooling metal. "South Service entrance, you're clear to approach," Blake said in Kate's ear. The agent had slipped a small earpiece into her hand before they left the lot. "No visible movement outside. Our people are in position on adjacent rooftops." "Copy," Kate said. Her fingers felt too big on the door handle. She opened it anyway and stepped out into air that smelled of damp concrete and cut grass. The trauma kit strap dug into her shoulder. A familiar weight. Lucas swung his legs out of the back seat with a stifled groan. "Stay low, stay out of sight," Kate said. "You're talking to a SEAL, not a tourist," he said. Still, he bent at the waist and kept to the line of shadow between parked maintenance carts. From here, the south stairwell entrance was a darker rectangle in the foundation of the building, down a short flight of steps. A metal door sat at the bottom, paint flaking, a narrow wired glass window set at eye level. Kate descended the steps slowly. Her hip reminded her of every millimeter it had ever been out of place, a hot line from joint to knee. Her hand brushed the cold rail, more for balance than fear. Halfway down, she caught it, a faint, wrong smell threading under the normal sense of dust and old paper. Gas, not strong enough to choke her, just present, like someone had opened a valve a crack. "I can smell gas," Kate murmured. "Say again." Blake's voice crackled. "I can smell gas," Kate whispered. "Old, maybe from the boiler. They might have rigged it." There was a pause long enough for her to picture Blake's face tightening. "Understood," Blake said. "I'm calling bomb squad forward. You proceed with extreme caution. Do not touch any exposed piping." "Copy." Kate did. She reached the bottom of the stairs and stared at the door. Her own reflection looked back in the glass, distorted by the wire mesh. Pale face, shadowed eyes, hospital scrubs under a borrowed jacket. Nightingale, the text had called her. She pushed the handle. The door opened on oiled hinges, noiseless. The hallway beyond was lit by tired fluorescent tubes that flickered, humming like the ones at Lonier. The floor was concrete, polished by years of traffic. Unmarked doors lined each side, some with typed labels about storage and maintenance, others bare. The air was cooler down here, heavy. She stepped inside. The door swung shut behind her with a soft click. "Inside," she whispered. "Got you," Blake said. "We have your location on the basement blueprint. Straight ahead, then left into the old periodicals wing." Kate moved. Her shoes made scarcely any sound on the concrete. The trauma kit brushed her hip with each step. She did not count them. She kept her attention on the corridor, on the play of light and shadow. At the turn, she hesitated, then peeked around the corner. Rows of metal shelving stretched into a larger room, their sides lined with dusty boxes and outdated journals. A few tables sat in the open space between shelves. Mismatched lamps casting cones of softer light. The ceiling was low, with exposed pipes running in thick lines overhead. Maya sat at the nearest table. Her hands were bound to the arms of her chair with silver duct tape. A strip covered her mouth. Her sketchbook lay open in front of her, pencil frozen mid-stroke. Her eyes were wide, pupils blown, locked on the doorway. Kate's throat closed. A man stood behind Maya's chair. Colonel Victor Draven looked much the same as he had in briefing rooms and tactical conferences. Hair gone whiter at the temples, lines deeper around his mouth, suit instead of uniform. The polished calm in his posture had not changed. He held a pistol in his right hand, the barrel resting casual against Maya's temple. In his left, slightly raised from his side, was a small device with a single red LED that blinked a slow, steady beat. "Hello, Brennan," Draven said. His voice rolled into the room as if he were greeting someone at a conference. Or should I say Nightingale? The sound of the call sign in his mouth turned her stomach. "Colonel," Kate said. She made herself walk forward, hands visible, away from her body. She stopped halfway between the shelves and the table, where he could see her clearly. "Step all the way in," Draven said. "I want to be sure you're alone." She obeyed. The light from the fixtures overhead fell across her face. There was no cover here. Only tables and chairs, too open for comfort, too cluttered for fast movement. You look good, Draven said, considering. Maya made a sound behind the tape, high and desperate. Kate locked her gaze on Draven, not trusting herself to look directly at her sister yet. You picked an interesting place, Kate said. Basement of a college. A little on the nose. We like familiar structures, Draven said. Low ceilings, limited exits. It keeps the noise down. His finger rested alongside the trigger, not yet inside the guard. His left hand, the one with the device, remained steady. That's quite a prop, Kate said, nodding at the small box. You planning to click something with that? Draven smiled. Dead man's switch, he said. Simple design. Pressure maintained keeps the circuit open. I relax my hand, the connection closes. Detonators go live, and the gas line does the rest. Bravo, Kate said. Maya's breaths came sharp and fast through her nose. The tape fluttered slightly with each exhale. If you shoot both of us, Kate said, you die in the same fire. You know that? I'm aware, Draven said, but if I walk out of here without leverage, I won't get far above ground either. He tilted his head, eyes narrowing just a fraction. You're stalling, he said. You wanted a conversation, Kate said. We're having one. Behind Draven, in the far corner, where the shelves met the wall, a sliver of darkness looked a touch denser than the rest. A shadow within a shadow. Something moved there. Too slow for casual. Lucas. He had found another way in, likely the parallel route Blake had promised. Repurposed. Draven followed Kate's flicked glance, but only as far as Maya. He did not seem to see the hidden shape beyond the outer racks. You made things very complicated tonight, Draven said. Intel was supposed to smooth your exit. Grant was supposed to keep you manageable. Grant is in handcuffs, Kate said. So I heard, Draven said. He was always too pleased with his own cleverness. Men like that forget to look up. His eyes hardened. You, on the other hand, should have learned your lesson, he said. We gave you a chance to disappear. We paid generously in bureaucratic terms. Doctor's notes, pension, a ghosted file. All you had to do was stay gone. You paid me with my own silence, Kate said, and with threats to her. She nodded at Maya. Draven shrugged one shoulder. Collateral arrangements, he said. Someone like you doesn't keep quiet for yourself. You keep quiet for someone else. You set that ambush in Nuristan, Kate said. I authorized a redirection, Draven said. Our friends across the valley needed supplies. We needed plausible deniability, a mutual opportunity. With American weapons, Kate said, in their hands. Is a rifle any less American when it's pointed back at us, Draven asked. It's already been bought, paid for. The only question is whether we sell it once or twice. He spoke about it like he was discussing shipping routes, not lives. Kate took a breath. The odor of gas was stronger closer to the center of the room. It coiled under the more familiar smells of dust and paper. You turned his squad into an evidence disposal unit, Kate said. You sent them through that valley to bleed on your shipping mistake. A miscalculation, Draven said. We expected lighter resistance. Someone talked. Someone always talks. His gaze sharpened. Like you, he added. Eventually. Maya shifted. The legs of the chair scraped softly on the floor. Kate lifted a hand slightly. Let her go, she said. You need me, not her. You know that. I needed you 3 years ago, Draven said. Now you're an inconvenience that refuses to stay buried. He moved the pistol just enough to press the barrel more firmly against Maya's head. The device in his other hand did not waver. In 10 minutes, Draven said, this building will be surrounded. My name will be trending for all the wrong reasons. They'll talk about treason and corruption and the rot in the system as if they haven't all eaten at the same table. Then walk out with me, Kate said. Tell them what you're telling me. Tell them how high it goes. Draven laughed softly. It sounded genuine, almost fond. You think the story ends with me, he said. You think there aren't men in nicer suits in nicer cities already rewriting this incident. He shook his head. No, he said. This ends like things like this always end, with a narrative about a disturbed officer. Maybe a disgraced nurse, a domestic terror scenario. Tragic, unfortunate, contained. His knuckles whitened around the switch for the first time. If I have to be the villain in that story, Draven said, I may as well choose my ending. He squeezed Maya's shoulder with his wrist as he spoke, fingers brushing her hair. She flinched. Behind the shelves, Lucas shifted again. Kate saw the faintest glint of metal at the edge of the shadow, the line of his arm bringing the pistol up. He had no clear shot. Maya's head and Draven's arm overlapped, a messy silhouette. Kate's heart drummed in her ears. She dropped her gaze deliberately to the trauma kit at her feet, then back up to Draven. "You're injured," she said, "your shoulder. You're holding that device above heart level. Blood flow won't stay kind to you." "Don't try to play medic with me," Draven said. "You came into this basement early," Kate said. "Set your wires, checked your valves. Now you've been standing here waiting, holding that position while you monologue. Your hand will cramp eventually. Your legs will tremble. You can't tell your story if you pass out before you finish it." "Don't tell someone who has led long patrols about standing," Draven said, but his jaw twitched. Maya twisted suddenly. For a split second, Kate thought it was panic. Then she saw the focus in her eyes. Maya planted both feet, shoved to the side as hard as she could. The chair tipped. It did not fall all the way, but it rocked enough that Draven's balance shifted. His gun hand came offline, swinging wide for a fraction. Lucas fired. The report was thunder in the low-ceiling room. The muzzle flashed through harsh light across shelves and faces. Draven jerked, a bloom of red exploding from his right shoulder. The pistol flew from his hand and skittered across the floor. Clattering against a metal shelf, his left hand seized around the switch. Kate was moving before he hit the ground. She crossed the space between them in 3 strides, dropping to her knees at his side. Her fingers clamped over his left hand, reinforcing his grip around the device. "Don't you dare let go," she said. The words came out in the same tone she used on combative patients who wanted to pull out their own IVs. Firm, absolute. Draven's face had gone gray. Sweat beaded at his hairline. Blood poured from his ruined shoulder, soaking his shirt, pulling under his back. "You should have taken the deal," he gasped. "You should have invested in better ventilation," Kate said. "Brennan," Blake's voice crackled in her ear. "We heard a shot. Talk to me." "Dead man's switch in play," Kate said. She did not take her eyes off Draven. "He's alive. He's hurt. If he loses consciousness, we all become part of a very loud news story. I need bomb squad now." "On their way," Blake said. Her voice had gone tight. 30 seconds. Maya's chair had settled back onto all 4 legs. Lucas reached her. He holstered his pistol clumsily and snapped a pocket knife open with one hand, cutting the tape binding her wrists. She ripped the gag away, dragging in a gulp of air that turned into a sob halfway out. "Kate," she choked. "Stay low," Kate said, not daring to look away from Draven's face. "Stay with Lucas." Draven tried to twist his head to look at Maya, but pain dragged his focus back. "There are others," he whispered. Blood bubbled at the corner of his mouth. "Bigger than me. Senators, generals, CEOs. You think you got the network because you got me and Grant." His eyelids fluttered. Kate leaned closer, her free hand pressing hard into the wound at his shoulder. He gasped and snapped back. "You don't get to check out yet," she said. "You started this party. You stay for cleanup." Boots thundered in the hallway. Bomb techs and tactical agents poured into the room, weapons sweeping, then lowering when they took in the scene. "Switch," Kate said without preamble. Pressure activated. His hand relaxes, we light the whole place up. A bomb tech in heavy gear moved in, eyes scanning the device, then the lines of piping overhead. "Got it," he said. His voice came muffled through his helmet. "On 3, you ease off. I take over. Stay with me. 1, 2, 3. Kate slid her hand away as the tech's gloved fingers replaced hers, clamping around Draven's. Another tech traced wires from the switch up along Draven's sleeve to a bundle taped against a support beam. Small charges clung to the metal in regular intervals. From there, more wires climbed to the junction of 2 gas lines. "Whoever set this knew what they were doing," the tech said. "Shut off valves in the boiler room," someone answered. "Back of the basement, east wall." An agent peeled off, sprinting in that direction with another tech. "Get them out of here," Blake said, appearing at Kate's shoulder. She jerked her chin at Lucas and Maya. "Now, up and out." Lucas helped Maya to her feet. She swayed, then anchored herself with a hand on his arm. Her eyes never left Kate. "I'm okay," Kate said, which was a lie, but close enough. They moved toward the hallway, guided by agents. Maya looked back once, twice. Then the darkness swallowed them. Draven's breathing rasped under Kate's hands. He tried to smile and only managed to grimace. "You can't protect them," he murmured. "There are more cells, more officers. This is not a network you can cut with one blade." "Good thing I work in a place with a lot of scalpels," Kate said. In the distance, a shout went up. Main valve closed. Secondary line secured. The bomb tech holding the switch glanced at his partner. Got a nod. then carefully eased Draven's fingers open. The red LED on the device blinked twice, then went dark. Safe, the tech said. For now. Kate sat back on her heels. Her legs tingled numb from the position. Blood soaked through the knees of her scrubs. Paramedics moved in with a stretcher. They slid a backboard under Draven, careful of the shoulder, careful of the still invisible web of danger that had hung over all of them a moment ago. Blake watched as they lifted him. Get him cuffed to the bed, she told one of her agents. Double restraints. He doesn't get to trip over his own IV and claim an accident. Draven's gaze found Kate one last time as they wheeled him away. You can't fight all of us, he said. Maybe not, Kate said, but I can start. He laughed, a weak, broken sound, then coughed as they pushed him into the corridor. The room stank of gas and blood and old paper. Kate finally let herself look at the chair where Maya had been. The tape still hung from the armrests in ragged strips. Her sister's pencil lay on the floor. Snapped in half, her hands began to shake. She picked up the broken pencil without really meaning to, the wood leaving a faint smear of gray on her palm. The overhead lights buzzed. Somewhere above outside, a helicopter's rotor thudded across the sky. They walked her out through a different door. Not the south stairwell, not the main lobby. A side exit near the loading dock where the cool night air pushed in and carried the smell of gasoline and wet concrete instead of gas and dust. Maya clung to Lucas's arm until they reached the threshold. Once outside, she let go and wrapped her arms around herself instead. Fingers still sticky with adhesive from the tape. Red and blue lights strobed across the side of the building, reflected in the glass of the upper windows. The sound of radios and shouted instructions filled the parking area. Campus officers kept a loose cordon around the scene, pushing back clusters of students who had drifted close despite everything. A paramedic with kind eyes and a worn jacket draped a blanket around Maya's shoulders. Even though the night was not cold enough for it, she sat her on the back bumper of an ambulance and gently checked her pulse, her pupils, the marks on her wrists. Maya answered questions in short, hoarse bursts. Her voice had that thin, stretched quality of someone whose adrenaline had not quite let go. Kate met her halfway. The collision knocked a small grunt out of Kate's chest. Maya's arms wrapped tight around her neck, squeezing hard enough to make her hip protest and her ribs creak. Kate held on just as fiercely. Maya's hair smelled like pencil shavings and cheap campus soap. Her shoulders shook. You're okay, Maya said into her shoulder. You're okay, you're okay. Pretty sure that's my line, Kate said. Her voice was rough. Maya leaned back just enough to look at her. Don't, she said. Her eyes were red, lashes stuck together. Don't ever tell me anything about what you did overseas was more dangerous than that basement. Kate almost laughed. It came out as a tired huff. Blake approached, the lines around her mouth deeper than they had been at the hospital. Colonel Draven is in custody, Blake said. Alive, although probably not thrilled about it. Grant is on his way to a federal holding facility. Between the two of them and the recordings Commander Hawthorne kindly collected, we have enough to start pulling threads. And you need someone to stand in front of a judge, Kate said. More than one someone, Blake said. But you're the one who saw both ends of the chain, the field and the paperwork. Lucas shifted his weight. My men will testify, he said. Those who can. Blake glanced at his IV line, then nodded. We can offer you protection, she said. Federal, new address, secure transport. Witness protection, Maya said. In some form, Blake said. Silence settled for a heartbeat. Blake broke it. This is your choice, she said. No one is going to drag you into a courtroom. We'll make a case either way. It'll just be a lot harder without you. Kate thought of the crates in Nuristan, the fresh paint on the wood. She thought of Lucas bleeding under her hands, of 3 other bodies they had not dragged out fast enough. She thought of Maya in that chair. Her fingers tightened around the pencil until the wood dug in. I'm not going quiet again, she said. The words came out steady. I'll testify, she said. I'll talk to whoever you need me to. I want protection for her and for him. She nodded toward Maya and Lucas. Non-negotiable, she added. Blake nodded once. We can work with that. Maya closed her eyes, then opened them. If she's doing this, I'm not hiding without knowing anything, she said. Blake studied them both. You two remind me of my sisters, she said, which is a compliment and a headache. Stone stepped closer. You should both be checked out properly, Stone said to Kate and Maya. Head to toe, no arguments. Maya started to protest, then saw the look on Stone's face and thought better of it. As the paramedics guided Maya and Kate toward the back of the ambulance, the helicopter overhead circled once more. The rotor blades thudded in a steady rhythm, a sound that had haunted Kate for years. Tonight it still raised the hairs on her arms, but it did not drag her under. Maya climbed into the rig first. Kate followed. The trauma kit finally sat down at her feet instead of on her shoulder. The doors closed with a solid thump. For the first time since the siren at Lonier had called in a mass casualty, Kate sat down without getting back up again. The sky over San Antonio was beginning to lighten at the edges. Not sunrise yet, just the promise of it. The thin gray line that separated night from morning. 6 weeks had passed. Kate stood in front of a classroom at Lonier VA Medical Center. 30 faces looked back at her, some young, some older, all attentive. The sign on the door read, Combat Medic Training Program. Director Kate Brennan. Most of you will never see combat, she said, but someday you'll face a situation where everything goes wrong, where the patient is dying, where protocol doesn't work, where you have to make a choice, she paused. I'm here to teach you how to make that choice, and how to live with it after. The classroom was silent. Outside the window, she could see the VA parking lot, old vets walking in, getting the care they deserved. Lucas appeared in the doorway, still recovering, but standing. He leaned against the frame, watching. When class ended, Kate walked out to find him waiting. How'd it go, he asked. Ask me in 10 years, she said. He smiled. You'll still be here in 10 years. Maybe. They walked together toward the parking lot, the late afternoon sun casting long shadows. Kate's limp was still there, would always be there, but she did not count her steps anymore. Her phone buzzed, a message from Blake. Trial date set, 6 months. You ready, Kate typed back. Yes, she slid the phone into her pocket and looked at the building behind her, the place where she had been mocked, dismissed, told she was a liability. Now it bore her name on the door. You know what the best part is, Lucas said. What? They tried to bury you, he said, and you grew roots instead. Kate thought about that, about Draven in his cell, about Grant singing, about the network unraveling, about Maya safe at school, about 30 students learning to save lives. Not roots, she said, wings. She started walking, not limping, not dragging, just walking, one step at a time, into whatever came next. Behind her, the sun dipped below the horizon, the sky turned gold, and somewhere in the distance, a helicopter's rotors faded into silence. The war was not over. It would never be over. But for today, for this moment, she had won, and that was enough.